This screencast is looking at the end of 2.2.3, where we're looking at the differences between arteries, veins and capillaries. So as can be seen quite clearly here, that our artery has much thicker muscular walls. Here on the, it doesn't show up particularly well, here on the vein, that muscular wall very thin, which does nothing to aid blood flow in the vein, but here nice and thick within the artery, so we do have contraction, relaxation occurring within the muscles of the arterial walls, which does aid blood flow. Now, because the muscular wall doesn't aid blood flow in the veins, veins all have valves that run along the length of the veins. So if we looked at blood flow going in this direction, if for whatever reason the blood tried to flow backwards, these valves would shut, stopping backflow of blood occurring. So the two main differences, that veins have valves and that the muscular wall of the vein is much thinner than the artery. Now when we look at the capillary, we can see that we have our layer of endothelium, which both the artery and veins do as well. However, there is nothing else to them. So they are very, very, very thin. They are porous, allowing diffusion to occur. The hole, at the size of the hole that the artery, veins and capillaries have, are referred to as the lumen. So if I just draw a very bad looking blood vessel here, the area here in which blood can flow is described as the lumen. So when we have fatty build-ups, etc., it's this fatty build-up within arteries that decreases the size of the lumen, therefore resulting in higher blood pressure, because the heart has to work harder to be able to force the same amount of blood through. And right down to the bottom of these pictures. Here, this little diagram also shows the blood vessels that connect arteries and veins to capillaries, and they're referred to as arterioles or venules. So arteries run into arterioles, which run into capillaries, and capillaries run into venules, which run into veins. So as we can see here, here's our arterioles. We still have our endothelium with our smooth muscle fibres surrounding it. Here on the other side with the venule, we have our endothelium. We have connective tissue which is going to connect it to the vein, but very, very little musculature there at all, even less than what our vein does.